All right, guys, back with part 2 of PALS certification. In this video, we're going to talk about AED placement, rescue breaths, IVIO access, and defibrillation. Let's get into it. So for AED placement, if the child is younger than 8 years old, we're going to use child pads if they are available. If child pads are not available, we will use adult pads. If the child is greater than 8 years old, we're going to use adult pads. It is very important. Do not use child pads on a child greater than 8 years old. It will not deliver a shock enough to resuscitate the child. The placement should be that the pads do not touch each other. So one's going to go on the front of the child and one is going to go on the back so that the pads are going to kind of sandwich the heart of the child. If the child has a pulse, but they are agonally breathing, we are not going to perform CPR. We're going to deliver rescue breaths every 3 to 5 seconds over 1 second each. For IVIO access, IO access is actually the preferred access for children because it is quicker. So with defibrillation is going to be indicated if the child is in VFib or pulseless VTAC. And so you've got to remember the amount of joules that we're going to deliver with each shock for children. So the initial shock is going to be 2 to 4 joules per kilogram. The second is going to be equal to or greater than 4 joules per kilogram. The maximum amount of energy that we're going to shock with is 10 joules per kilogram. If you remember this mnemonic, it'll help you remember these joules, and it's 2, 4, 6, 8. That's how we defibrillate. I hope you found this helpful. I'm going to be doing one more video that kind of touches on the 2020 updates to the PALS certification test. But as always, follow for more and go Vols.